Hi, my name is Jay Watson. I'm a physician assistant at the Children's Hospital of San Antonio with pediatric orthopedics. This is my esteemed colleague Whitney, and today we will be discussing Buck's traction. Buck's traction is a process to set up an actual pulling device that will help alleviate pain and discomfort when a child or a person has a femur fracture. Buck's traction is appropriate for those that have a mid-shaft fracture that are shortened and or angulated, not a distal femur or a proximal femur, but your attending will be the one to determine that diagnosis. First and foremost, as far as setting up the Buck's traction, age-wise would be anywhere from the youngest is 18 months. Any younger than that, they're too small, we'll pull them off the bed. A long leg posterior splint would be appropriate for that age group. As far as how old they can go, all the way up to adult, because we do occasionally get the adults at the Children's Hospital. As far as setup, you need a regular hospital bed. Your gurneys in the ER will not fit because they're too narrow. This device will already be put together for you, and it slides into the holes at the bottom of the bed, the foot of the bed. The foot plate does not need to be removed, just like that. This apparatus has the pulley system. It can be moved left or right depending on the side by untwisting the knob, flipping it, moving it to the appropriate leg. We're going to say Whitney has a left mid-shaft femur fracture that's shortened today. Tighten it down appropriately so it's nice and firm and not moving. Once that's got set up and your patient's on the bed, they're comfortable, then you want to choose the appropriate boot. And the appropriate boot size is based on the patient. So with her, we're going to go with a extra large. The key thing with the boot when you're lifting the leg is obviously being very careful. The kid's going to be hurting, so you may need some help with this. And you want to place the leg into the boot with the heel all the way to the bottom. Once that is in place, the most important part of the whole thing, not just the size, length doesn't really matter too much, but you definitely want to make sure that the boot wraps around all the way around the leg itself, that there's no gaps in the boot. This will cause swelling, irritation, plus your Velcro straps will go over and rub and cause irritation as well. So once the boot is around, you got the appropriate size, the foot's all the way to the bottom, you can go ahead and strap it down. It's just Velcro straps. Does not need to be too tight, but it needs to be snug. And this one goes around the foot to keep the foot in place. This is the part of the pulley system, and you want to make sure that it's unraveled and nice and flat so you get a nice parallel pull to the leg itself. Once that is set up, you will choose your string from the rope. Everything is in your blue box here, from weights to extra string, and we'll go to the weights here in just a second. Once you've chosen the string, we've already pre-measured for video purposes. We'll string this through the pulley system, go down, and then you want to tie the other end to the boot itself. And basically any knot will do. Square knots are pretty good. Those are in Boy Scouts, Girl Scouts, probably can tie a better knot than I can. Make sure we're tight. Now, once that is on, you want to again make sure we're pulling nice and parallel with the leg, not to the side or off in an angle. And then you're going to grab your weight holder, which again, everything is in this blue box. This, you do not want to touch the ground. Obviously, that would not be helpful as far as traction is concerned. How to tie a knot with this, you want to make a loop, and then you want to fold it around and through the hole, and that will hold your weight. Make sure we're not on the ground. Now that you've gotten that set up, you can choose the appropriate amount of weight. If it's an 18-month-old, I'd probably start off with 2 pounds. Make sure they're comfortable with that. It's okay to start off with a lighter weight and work your way up. If it's an adult or a larger child, then what you can do is probably go up, start off with 5, and then if they're still spasming, That's the whole point of buck traction, is to keep them comfortable and keep the spasms to a minimum. You can increase the weight. I wouldn't go over about 15 pounds. And again, as you're adding the weight, you always want to make sure the boot is not moving or shifting or causing any irritation to the patient's lower extremity. So we'll start off with 5 pounds just for demonstration purposes. So you would slide the weight, goes through the square part, and then you slowly lower it down so that they feel the pull. Do not drop the weight. How does that feel, Ms. Whitney? Awesome. So for demonstration purposes, we're not going to add any more weight. That's how you set up the bucks traction. Also recommended by your attending, hopefully, would also be to give the patient Valium to help relax a little bit and also help with the spasms as well. They can stay like this all night long. They can go up to the 11th floor or whichever appropriate floor they're going to go to that night if they're not going to go to surgery that night, and they can stay in bucks traction all night. As far as getting on and off the elevator in our hospital, this part will stick out. It's too long. So once you get to the elevators, number one, you want to make sure as you're rolling into the elevators, this is not swinging around and causing any irritation. While you're in transport, it's perfectly okay to take the weight off nice and slow, place it on the bed. When you get to the elevator, this will need to be undone here and rotated in an upward position. That will be enough room to get on the elevator. Once you get off the elevator and into the patient's room and everything's set up, then you can just undo it again, rotate back down where we were, get it parallel to the leg, tighten appropriately, and then hang your weight back off. And again, I stress nice and slow. If the patient is still spasming and having issues, you've already given Valium, you've already got some weight on there, then would be the appropriate time to add a little bit of weight. The weights come in 5 or 2, and I think we even have a 1 pounder. You can slowly add weight depending on the size of the patient. If you notice the patient is starting to slowly move down the bed because the weight is too heavy, a couple of tricks you can try, because you want to keep them nice and straight. You can put a pillow underneath their bottom. That'll kind of give them a speed bump and block them from sliding down. I would not recommend raising the legs too much, although you can slightly, just a little bit. And again, that should give them enough bumper to keep them from sliding down the bed. Is that comfortable?
Yeah.
Awesome. So once they're set up, then the orthopedic surgeon will be the one to come in and check the patient. The nursing staff on the floor should be doing neurovascular checks throughout the night to make sure they're comfortable, they have good feeling, good capillary refill, and that they're staying comfortable, and the appropriate medications are on board to keep them comfortable throughout the night before going to surgery. Now that we've had the bucks traction all set up, the patient is comfortable, parents are going to have a lot of questions and concerns, and they probably had a lot of questions and concerns even before you set up. The biggest point and concerns that I run across is, why are you pulling on my kid's leg? They have a broken bone. This is going to hurt. This is going to pull on everything and cause them more pain. Well, in reality, what you're doing is not only helping us as the orthopedic team to lengthen the bone and keep it out to length, so that makes it easier for us when we go to surgery, but also you're helping the patient. How do you help the patient? You're keeping the spasms down because you've already given them Valium. That will help with that. But also by pulling on the leg and keeping the muscle out to length, that will decrease the amount of spasms and it will keep them comfortable throughout the night. If you don't put them in bucks traction, the muscles will contract, the bones rub together or move, and that causes pain all night long. And you have very unhappy kids that are very tired and very unhappy family members. So you explain to them that this is important in order for them to be comfortable throughout the night, and also will help with the procedure that's going to be done either that night or the very next morning to keep the bone out to length. It makes the procedure a little bit easier for us as well too.